I wonder what you think about how I'll use the word translatable, but how you think we'll be able to move this going forward. Do you think that this will replicate is this going to be drug specific, or do you think that we will be able to take this and, how would you now, do you feel like, as you kind of just hinted at, hey, we're not going to be able to look at just one marker, it's going to be an integrative approach. Is there something specific that you felt like was more exciting from this work that you feel like, should be looked at in future, clinical trials?
Yeah, no, those are really, really important questions. I think really we've seen a lot of things that come up in individual studies, and it's really sometimes hard to replicate those. Even though we see, for instance, an immune signature in Emotion 150, we have a slightly different immune signature for Javelin Renal 101, and they don't always cross-validate, which can be challenging. And so I think replication is going to be the key in making sure these findings are robust across studies. I think some of them will hopefully be agnostic to therapy, because some of these are really associations between what seem to be tumor and host genetics and particular immune populations. So those are hopefully going to be agnostic to therapy. But the associations with clinical outcomes, I think it's going to need validation. We know that anti-PD-L1 drugs, they seem like they behave a little bit differently from anti-PD-1 drugs in kidney cancer. And so it's going to be really important to validate these in other phase 3 trials that have looked at anti-PD-1 based combinations, and hopefully in pure immune therapy based combinations as well. I think that honestly, the thing I'm most excited about is certainly individual threads of findings that are going to be important to follow up. But I think the part that's probably most important to me is sort of a bit of a roadmap for how to think about future trial design and conducting these sort of biomarker-based studies. This, I think, provides really good evidence that looking at just the tumor alone and one feature in the tumor alone is probably inadequate. And I think there's been rising data to support that. And so when we think of how biomarker studies are going to be conducted in the future, these sorts of translational studies, whether it's large phase 3 trials or small investigator-initiated trials, I think it's going to be looking at baseline tumor. I think it's going to be looking at host genetic factors. I think it's going to be looking at circulating immune populations. This begins to look at it through TCR analysis, but I think there's other ways certainly to look at it as well. Broader sort of chemokine, cytokine, and growth factor analysis within the plasma, and bringing that all together with the tumor microenvironment to really get a sort of comprehensive view. And I think, that's, to me, makes sort of more and more intuitive sense, but I think this actually provides some good scientific support, some data to actually say these things really do interact and potentially impact clinical development. So there's nothing in this that I think is going to change how we sort of practice tomorrow and how we sort of stratify patients tomorrow. But my hope is it provides a bit of a foundation for the next set of studies that's really going to hopefully tease this apart.
I totally agree. I think it really shows, again, that the effort can be accomplished, even in this large cohort, which is really where we learn the most. Our patients give so much of themselves to participate in all these trials, and we want to collect quality of life and we want to collect efficacy, but we really need to learn, kind of next steps.